I think that he can do that and do it justice, and he's got plenty of great managers to help support him and directors. So we'll be good. And I have no doubt Tish will be paying attention to everything that she needs to.
Oh, yes.
Yeah. So
Habits don't.
that's my report.
Thank you.
Mm-hmm. Foundation report. You guys probably need that from me too, huh?
Yes.
The foundation is giving money. I don't know if there's going to be the full amount or a portion of it, but they were talking like they're going to do the full amount for the Babel Farm. It's a $12,000 item that is used for respiratory care. We've actually been testing it out now for couple months. What it does is it allows people to get care here at our facility without having to leave. They don't have to get an invasive intubation, but they can actually be on high flow oxygen and or similar to a CPAP, but it's only through the nasal cannula. It's warmed and all those kinds of things. It's a godsend that shows that it's actually better and has better outcomes than you do with CPAP, BiPAP, or intubation even. So it's something to be able to allow patients to have their ability to be here if they have COPD, pneumonia, some sort of RSV or something that's really serious. So I think even asthma is part of that. So they should be paying for that, but I just need you guys to know that so that you don't really need to vote on it because we've asked them. I don't think. If they don't pay for the full amount, I'll let you know, but I think they will. It's a $12,000, whatever it was, $222 or something like that, piece of equipment. And then they also approved providing the education and the books. I asked them to hold off on the course, the exam, because I do that with my employees. There's going to be a dietary management course that's going to be taken by Melissa, and that course is $600, and then it's $333 for the books, and they're paying for that full amount. And then I told them that she finishes it and does well, then we'll come back to you to ask for the $425, because I just like carrots. I don't like to give people full money all at once because I want to see results. So that's what we're doing there. Okay, and they approved it. So, and I think the only other things they talked about is they're going to be moving to a schedule that isn't going to be every month. It's going to be 5 times a year. That's what they can do by regulations. So they're going to move to I got to remember, it's like January, March, May, July, and they have to meet in October, something like that. I'll make sure I get that down for you guys, but they're going to meet 5 times a year instead of every single month. And they do have a couple of people that they're looking at to sign on to become foundation board members. Green doesn't want to do it. Yeah, but they do have somebody whose name you probably would all know, Womack. Somebody Womack. Yeah, I think that sounds right. That she sounds interested in doing it. I don't know the second person. Then they gave me some ideas of some names for us to talk with people to maybe get more foundation money towards the CT. So I will look at that. And that's pretty much the foundation board meeting in a nutshell.
Thank you.
Mm-hmm.
Hey.
It's only 6:45.
So
No.
Are you going to say before executive session or after?
Yes. Well, let's take a 5-minute break before executive session. Walter's not here to growl, so we will. We'll do 5 minutes before executive session, and then we'll move into executive session.
Okay, guys, so that is your ability to push 1 week. So. Awesome.
Oh,
I got a question related to the executive session, just generally. Weston County Mental Health Services, not Mental Health, Health Services District has a public records policy, correct?
Yes.
And that was your attorney involved in setting that up? So,
Yeah, but it's been a while ago, yeah.
in a while, okay. I would just point out that that policy on page 7 of 9, number 4, under public records is defined by Wyoming law, unless privileged or confidential by law. These are public record. Number 4, all agreements and contracts with the government entity is a party.
Sorry?
All agreements and contracts to which a government entity is a party is listed in our policy as public records. And I just wanted to point that out in case that if someone thinks that's a problem,
Okay.
that will need to be addressed.
Okay. Thank you.
so basically, like, so tell me if I'm understanding you right. So basically, if somebody asks, we as a public records, we have to give it to them.
I think that's what council said earlier.
Mm-hmm.
Yeah,
It's a public,
and that's
a done deal contract, public has the right to know about it. How is
They
that?
do, but they can be asked to do written requests for stuff.
right.
Right.
It's not like it's,
We always give them stuff, so I mean,
yeah, I don't think it's like,
We try to be as
yeah,
we can.
Which we did do that in public session last.
mm-hmm,
yeah,
mm-hmm,
right.
yeah.
And so if it's not written right in somebody's view, if you need to fix it.
So
I never looked at it again anyway.
So you think it's written right or not?
I do, but I'm not your attorney.
Right.
I'll mention it to Ellen if she wants to review it again at some point.
Yeah, good idea.
Yeah, I can flag that for Allison too. I have a email going for her for when she's back in the office.
Yeah. She has access to our policy, so she'll be able to get right in there to look at it.
Yeah, and if she needs it, I just recently did 2 public records policies for 2 other hospitals. So if you guys want to have Allison look at yours and compare to what I've done with other ones, that's available to you too.
Okay, thanks, Abby.
Yeah.
Right before Kathy came,
That's probably right, because we haven't done it since I've been here. We just reviewed it.
but I might not be remembering it right, but I.
All I do is policies, so.
Like Kathy said, as long as it doesn't have patient information or anything in it, we don't
We just tell
anybody
people
about public records. We just give them to them.
we always get our financials and stuff, yeah.
Okay. The statute allows, your Public Records Act, it allows you to withhold disclosure for a very limited set of circumstances. So for me personally, I never disclose personnel files without a court order, patient information, HIPAA protected information, but pretty much, with any governmental entity in Wyoming, you err on the side of disclosure, and produce. What I've seen, the trend lately I've seen though is people have kind of started weaponizing public records requests for litigation. And so even before litigation has been initiated, you're getting public records requests from, plaintiffs' attorneys or whoever. So that's been an interesting thing, which is why with a number of the hospitals I work with, we've instituted public records policies that you're allowed to charge a reasonable fee. And part of that includes, your attorney's fees and costs, if that's who you have going through and producing those records. So if we have a lawyer on the other side, then we're very careful about what we're producing. That's just kind of how, I will just email Kathy the public records policy that I recently worked on. And then that way you guys can just compare and contrast.
That's great, thank you.
Yep.
That'll be good, and I appreciate that, Abby.
Yeah.
And
Yes, oh,
Yeah, there has been we are doing it, but there are some situations where some hospitals have been inundated with massive amounts of requests for records. Some of that, I think, what our answer is to never get litigated. That would be our answer. But should you ever have that happen and stuff, I think it would be good to have something that says that it has to be reviewed by our attorneys. They pay the attorney fees for that and the reasonable fee for copying.
I totally get that, and that wasn't, I don't know what William had in mind, but when I heard what you were talking about, I mean, it's my thoughts that if it's just a member of our public, of our community, and they want the information, we do our best to give it to them. You know, yes, we can hold the request for 30 days or anything like that, but we don't try to hassle anybody, and I like that we do that. We just...
Yeah, in fact, the newspaper tends to like to have us give that to them like the next morning. So, and we usually do. Yeah,
I appreciate that. Yeah, you kind of feel that same way, that whatever we can with no problems give people, we do.
Right, exactly.
Yep.
I guess our other people will just call us. I know that's what's going to happen too, is they're going to call to say, what time did you guys adjourn?
So what, we need a motion about
Fish.
fish.
I think I got it. Maybe I got too wordy here, I'm not sure, but I move that the CO be given the permission to enter into contract, or enter the hospital into a contract with the Tisch Miller Company LLC at the rate discussed, with the stipulations and limits discussed,
Yes.
and limited to the 31st of December 2025.
It's going to take a lot more than a 5-person economic development board, or the 7-person city council, or the 5-person county commissioners, or even the hospital board. The public at this point really needs to have a stake in the game and needs to come forward and to have some honest discussions and some ideas, and even more than just the community, I'd say the younger people, those younger people in their 20s that are in Newcastle and Weston County raising their kids, those people that don't want to leave, those people that want their kids to grow up in Newcastle and graduate an NHS Dogie just like they did. Those are the people that are going to have to step up and come forward and offer some solutions and do a little bit of soul searching and becoming a more active member in the community.
And does that still give us?
It does. Well, it says it does have a renewal. The one piece that you might add is that upon request can be renewed for 30 days at a time.
Shall we just say the terms discussed in executive session?
Yeah, that works. I think you did pretty good though there, Glenn.
Shut up.
Job that for the
I second that motion.
Okay.
It sounded pretty good.
The 31st.
Any further discussion?
Most interesting thing said in this meeting was said by you.
Really?
And I'm waiting for it. You said, correct me if I'm wrong. How long am I gonna have to wait?
Thanks, William. Okay.
Oh, I got that.
Is there any further discussion on this motion?
Thank you very much.
Okay, so, yes, we need to vote. So I'm just trying to think of the right words. So all those in favor say aye.
Aye.
All those opposed, the same. Okay, so the motion is passed. We're giving Kathy, go ahead, too.
Madam Chair, may I make a motion to approve the credentialing of Dallin Christensen, MD, ear, nose, and throat, and Gurjeet Singh, MD, neurology?
Do you have a second?
Second.
Okay, any discussion? All those in favor say aye.
Aye.
All those opposed, the same. Okay. We have
Miracle.
I didn't see your hand.
What happened?
Legitimate.
You're gonna have to tell Allison that this week somehow got over with you here a lot earlier.
I plan on holding that over her head.
Thank you very
There's
much.
very little I can hold over Allison's head, so I am gonna rub this one in.
Thank you.
Okay, so we now,
joining us.
we need a, motion to adjourn.
Well, I move to adjourn. I'll second this.
All those in favor say aye. All those opposed say.
Adjourned at 7:45.
Thank you guys for allowing me to join. It was nice to meet you.
Thank you.
I can't even say 7:45.